Okay, so good morning, students. Today we will be discussing on the topic of ascites. Is it visible? The screen? Can you all see?
Yes, ma'am.
Okay. Okay, so once again, good morning, students. So today we will be discussing on the topic of ascites. So this picture it shows the normal abdomen. In this picture, you can see that this is the abnormal abdomen, which means ascites. So, what happens in ascites? Let's see. Okay, so this is ascites. So, ascites it occurs. What is the ill effects or what is ascites? So, ascites means what? Means when there is accumulation of fluid in the abdomen. So, this is the abdomen. This is the abdomen, and inside this abdomen, what will you find? You will find some fluid, means watery substance. Understand? You will find some watery substance, means there will be accumulation of fluid, means there will be collection of fluid in the abdomen, which is abnormal. Understand? This is a normal abdomen and this is the abnormal abdomen. So this means ascites means accumulation of fluid, accumulation of fluid in the abdomen. Is it clear? Okay. Okay, so next is causes. So what can be the causes of ascites? It mainly occurs because of what? What is the reason behind this ascites? So in ascites, what can you find? You can find that it mainly affects, or else you can say it mainly cause um, the internal organs or else visceral organs, which is liver. The liver is mostly like caused because of this. As a result, ascites occurs. So what happens in the liver? You can see like the liver becomes fatty liver. Understand? Means this is the liver, and here fats are being accumulated. Means fats are present there inside the liver, and because of that, what will happen? Liver fibrosis. Liver fibrosis means what? Scar. Means in the liver you will find that there will be some scar. There will be some scar formation in the liver fibrosis, and ultimately it will lead to cirrhosis. When it will lead to cirrhosis of liver, what will happen? It mainly destroys all the liver tissues, all the liver cells, all the tissues. It's mainly affected. So as a result, ascites occurs. And what will happen because of this cirrhosis of liver? There will be blockage of blood. Means when circulation will occur, what will happen? When it will come towards the liver, what will happen? Means it won't be able to circulate the blood anymore, since there is some abnormalities going on in the liver, right? So that's why there will be blockage. The blood will block, which will lead to ascites, and ultimately it will lead to failure. Acute liver failure means the liver will fail to perform, the liver will fail to function normally. So this is the reason why ascites occurs. And next is cancer, abnormal growth of cells. So cancer also is the cause for ascites. And the last one is nephrotic syndrome, because of what? Because of the liver. Sorry, because of the kidney. Inside the kidney, what do you have? Nephrons. It's not a structural and functional unit of kidney, nephron. So because of some nephrotic syndrome, also because of some liver, sorry, because of some kidney problem, also this ascites occurs. Are you clear about the cause of ascites?
Mm.
Okay. Okay, next is risk factors. So this ascites it mainly occurs to whom, like who are at the risk of having ascites. किस किसको ज़्यादा ascites होने का chances है, किस किसको ज़्यादा risk है ये ascites होने का. Okay, let's see the first. पहला देखते हैं क्या है. Exposure to hepatitis means if a person is like having hepatitis, like for example, hepatitis is mainly caused how means how it is caused. Practicing unsafe sex means if a person is not using contraceptive devices such as condom, pills, and all that, so the person can have hepatitis, and ultimately it will lead to what? It will lead to ascites. Understand? Next is unvaccinated. Like if a person is not taking vaccine for hepatitis, so they are at the risk of having ascites. Next is uh, when a person takes drugs. Drugs in the sense like what? Sharing needles. Especially you can see in teenagers means who are young people. No? They share the needles uh, in order to like what to say in order to experience something because of peer pressure. Also it mainly occurs. So if they share the needle like from one person to the other person, what will happen? Hepatitis can occur. So all these are the three main factors for the cause, or else we can say for the of the risk factors of ascites. First point. Next is heavy or frequent alcohol use. Means if a person drinks too much of alcohol, what will happen? It will affect the liver, and ultimately it will lead to ascites. The next one is certain medications. Means if a person is having like some medications which is not good for his or her liver, what will happen? Ascites will occur. The last one is chronic health issues. Means if a person is having some health issues, say for example heart problem, understand heart problem, or else kidney disease such as nephrotic syndrome and all those. So they are at the risk of having ascites. Next is consumption of alcohol. We have already discussed because of consumption of alcohol, having too much of alcohol, the person will be at the risk of having ascites. Next is low protein diet. If a person is having low protein diet, means if a person is not having any protein, such as egg, fish, then chickpeas and all, not chana, all these are high protein diet. So if a person is not having those kind of diet, what will happen? They will be at the risk of having ascites. Next is weakness and fatigue. Means if a person is weak, uh, yeah, if a person is weak, physically weak, so they are at the risk of having ascites. So all these are the risk factors that you will find in ascites. Is it clear? The risk factors?
Yes.
Okay. Okay, so this is alcoholism. So I'm just showing you in general, like if a person is like addicted to alcohol, अगर एक इंसान मतलब बहुत ज़्यादा शराब पीता है, एडिक्टेड है, तो उसका क्या-क्या organs affect कर सकता है. So if a person is addicted to alcohol, what are the organs that it can affect in a person? Okay, first let's see. This is just general knowledge. Okay, this is not included actually in this ascites, but I'm just explaining you all for your own general knowledge, basic knowledge. Okay, so cirrhosis of liver means in if a person is like addicted to alcohol, what will happen? It will affect the liver. Understand? Means metabolism. The function of the liver is what? Metabolism. It metabolize. It's not it. So it will affect the liver, and it will lead to cirrhosis of liver, fatty liver, and ultimately it will lead to this one, ascites. Next is kidney failure. The kidney can also fail because of this alcohol. Next is chronic heart disease or chronic heart failure. So it can affect the heart also. means it won't be able to circulate anymore. I mean, it won't be able to circulate normally anymore like those days. So alcohol affects this. Next is damage to brain function. It will damage the brain function also, like neurons. Understand? It will affect all those. It will affect all those also. Like for example, I'll just say one example. Like when we were posted in psychiatric ward, we found one person who was addicted to alcohol, and it was affecting his mental health also. It was affecting his mental health in the sense like he was mentally disturbed. He was mentally disturbed in the sense like what to say, like he was like hallucination, like hallucination means what, like what a person means you can't see, but only that person will be able to see, like who is having that thing, na? Hallucination. So he was seeing like some small creatures, he said like that. He was seeing some small creatures and it was coming towards him. So he was really scared. So like that kind of history like we were finding in one alcoholic patient. So it affects the brain also in that sense. And some patients, what they become very much aggressive. They becomes very much aggressive in the sense like they beat their loved ones whenever they come home. What do they beat someone, their own children, their own wife, their means their own ones. They are mentally disturbed, so that's why like they becomes aggressive, means they become wild, means yeah. In that thing, like the alcohol, this alcohol, like who are addicted to alcohol, it affects the brain also. It affects the neuron, means neurologically also it gets affected. And in some patients, what happens, they tremble, वो लोग कांपते हैं, means seizure kind of thing, and they tremble. Like if you will ask them like to place their hand forward in this manner, what will happen? When I'm placing my hand, it's normal. It's not that I'm not like shaking. But if you will ask the alcoholic patient like to just uh, move their hand forward, what will happen? What changes can you see in that alcoholic patient, or else you can say alcoholic person? You'll find that the hand will tremble in this manner, like he or she won't be able to remain still. अंडरस्टैंड? वो लोग सीधा नहीं रह सकते, वो लोग कांपने लगते हैं। देखिए क्यों? क्योंकि उसका ब्रेन इफेक्ट कर, उसका न्यूरॉन्स इफेक्ट करता है। यू रिमेम्बर ना नर्वस सिस्टम? याद है ना नर्वस न्यूरॉन, नर्वस सिस्टम न्यूरॉन्स, तो it affects in that way also. Okay. And sometimes what happens, it might lead to some kind of mental disorder also. If a person is too much alcoholic, no, it happens. I have seen personally also. I've experienced. I mean, uh, when I was posted there, means in the ward, I have seen. So it affects the mental health also. Okay, is it clear?
Yes, ma'am.
Okay. Okay, so next is treatment. What can be the treatment for this ascites? The first one is abstaining from alcohol. Abstaining from alcohol means what? A person should totally cut out the alcohol. Like if a person is having too much alcohol, ना, they should cut out. वो लोग को वो ये जो अल्कोहल है, मीन्स दारू है, उन लोगों को पीना नहीं चाहिए, पूरा मतलब काट लेना चाहिए. Okay, next is consumption of low amount of salt. So what they should do, they should have um, suppose say for example like if a person used to have one teaspoonful or else two teaspoonful of salt, what they should do, like consumption of low means they should consume only like half of teaspoonful of salt, like that means it's not like they should totally cut out, like they should uh, slowly and steadily, like they can decrease the amount of salt whatever they are consuming ना. अगर उन लोग को एक चम एक चम्मच या 2 चम्मच पहले खाता था मतलब नमक, तो उन लोगों को कैसे कम करना चाहिए, मतलब धीरे-धीरे आधा ऐसे करके कम करना चाहिए। ऐसा नहीं है कि वो लोग को टोटली मतलब वो करना चाहिए, लेकिन धीरे धीरे करके ना, धीरे धीरे करके उन लोग को जो नमक है कम खाना चाहिए. Okay, the next one is paracentesis. Okay, or else you can say as acetic tap. So what usually happens? I mean, how why it is usually done? This paracentesis. Why it is usually done? So that they will take out all the fluids, whatever is there in the abdomen. Whatever is there in the abdomen, they can excrete out. They can take it out. Whatever accumulation is occurring or whatever water is accumulated in the abdomen, like they can take it out with the help of syringe. It's a syringe, so they can take it out. So why this thing is like done? Why it is usually done? It is usually done because the first one is diagnostic. Diagnostic means what? Like what is the condition of the patient? Why it is occurring to that person? Because of that, it is done. The next one is therapeutic. Therapeutic means to treat that condition, like if in order to know like a person is like too much severe or else too much like middle or else too much mild, no? Means mild moderate, you know, the mild moderate and all. Mild means not so serious, understand? Moderate is like neutral, you can say, and severe, you all know severe means very much severe. So like in that way they can know that individual, अंडरस्टैंड. थेराप्यूटिक इट मीन्स दैट. पहला क्या है, डायग्नोस्टिक, मतलब उन लोग को डायग्नोस करते हैं, मतलब पेशेंट का हालत कैसा है, वो लोग ज़्यादा सीरियस है, वो लोग मतलब मीडिल है, या फिर वो लोग मतलब ठीक ठाक है, वो मतलब कंडीशन पेशेंट का कैसा कंडीशन है, ये जानकारी लेने के लिए ये डायग्नोस करते हैं. ठीक है. दूसरा है थेराप्यूटिक, मतलब जब उन लोग का कंडीशन कैसा है, मतलब जब पता चल जाता है, वो कैसे ट्रीट करने के लिए, कैसे उसका देखभाल करने के लिए ये पैरासिम्पसिस है, वो इट इज मेनली यूज, ज़्यादातर ये यूज करते हैं. Okay, so this is the process. So this is the way how they do. So they usually like इन लोग को लेटाना पड़ता है बिस्तर पे. They usually lie down the patient on the back, and it is done in this manner, like syringe is being inserted like here. जो syringe है वो लोग अंदर में घुसाते हैं. उसके बाद क्या करते हैं, this is the drainage catheter, like for the drain like to come out, like for the fluid to come out. ये जो drainage catheter है, जो यहाँ पे जो पानी है वो निकल आने के लिए, ये जो पाइप का जैसा है, ये इट इज यूज, ये हम लोग यूज करते हैं, and it is being inserted here, that is in the drainage container. और जो जो फ्लूइड है, जो एब्डोमेन में जो जो फ्लूइड है, मतलब जो जो पानी है, तो यहाँ पे कलेक्ट होता है, मतलब जमा होता है. एंड हियर आर सम लेबलिंग ऑल्सो. यहाँ पे स्केल में तुम लोग देखते हो ना, मापने का 1 सेंटीमीटर 2 सेंटीमीटर ऐसे करके. सो सेम थिंग, दिस ड्रेनेज कंटेनर ऑल्सो देयर इज सम लेबलिंग, like you will be able to know like what is the total amount of fluid which which is being collected in the abdomen. So in this way, like you can know. Okay, is it clear? I guess it's clear. Let me ask you some questions. Paboklan, can you hear me?
Yes, ma'am.
Okay, what do you mean by ascites?
Ascites occurs when fluid accumulates in the abdomen.
Okay, okay, very good. Next, Darshana.
Yes, ma'am.
Okay, Darshana, can you tell me what are the causes of ascites?
Uh,
Uh-huh. Causes of,
cancer,
okay. Anything else? It's okay. Ilashra, can you tell me?
yes, ma'am.
Can you please tell me? Hello.
Liver failure, ma'am, acute liver failure,
Liver failure.
acute,
Okay. Okay, Ilashra, can you tell me some more?
diabetic syndrome,
Okay.
cirrhosis of
Cirrhosis of liver. So, what do you mean by cirrhosis of liver?
fatty liver,
Okay, fatty liver. And because of the cirrhosis of liver, what will happen? There will be blockage in what?
blockage in blood,
Blockage in blood flow. Okay, very good. Okay, next, Monica. Monica. Monica, can you hear me? Okay, then Mercy. Mercy.
yes, ma'am.
Okay, can you tell me some of the risk factors?
Yes, ma'am. Exposure to hepatitis, including practicing unsafe sex, remaining unvaccinated for hepatitis B, and drug use, heavy or frequent alcohol use.
Okay. Anything else?
Weakness and fatigue, and low protein diet.
Okay. Okay, very good. Okay, which person? Which person? Rudolph. Rudolph. Okay, can you tell me some medical treatment for this ascites? Can you tell me like some of the treatment, medical treatment for this ascites? What procedure is being performed in order to take out the excessive fluid from the abdomen? We are means one procedure can be performed. Na? So what is the name of that? Uh-huh. Don't know. Okay. Okay, Samuel, can you tell me what is the name of that procedure?
Parasynthetist.
Okay. So how it is done? Can you tell me?
With the help of syringe, they can suck out.
Suck. Don't say suck out. Okay, means they take. We say they take out the excessive fluid. Okay.
Yes, ma'am.
So this
Yes, ma'am.
is the drainage catheter. Wait, let me show you. So this is the drainage catheter. So with the help of this, like it is being like what to say, carried out, and it is accumulate. I mean, here it comes out, and you should also know one thing, like the gravitational force. You know, in science, you have studied gravitational force. In physics, also, you have studied gravitational force. It's not it. Hmm?
Yes, ma'am.
Hmm. So you have to apply that gravitational force also. Means what? That means you should not. Suppose this is this one, huh? The drainage catheter. So you should not like place like this upside. It's okay. Means you should place down. Like you should perform that so that the fluid, na, it will come out. Obviously, like if you will take out something, you won't place this catheter upside like this. It's not it. You have to place down so that the the fluid, like, it will come down. So that's why you have to apply that force over there. That is the gravitational gravity. Understand, everyone?
Ma'am.
Okay. I hope it's clear now, all of you, today's class.
Yes.
Okay. And one thing, like they should have low, uh, this one, salt, amount of salt. Okay, and they should cut out alcohol also, because alcohol is the main reason. Alcohol is the main reason for this ascites. So a person should cut out alcohol. Okay. Okay, then if it is clear, then we will end now. Thank you.